she told me was, Desiree, you do not have to reinvent the wheel on everything. And I was just like, okay. And the thing that I was doing at first, so when I got into the Department of Health, I was working on this grant, and it was called the 1305 grant from CDC. Every state had this grant, and it was like focused on like chronic disease prevention. And I was managing pieces of that grant, and I was literally trying to figure things out. Like, I had no blueprint, we had no historical documentation. Like, it was literally nothing there, and I was like trying to start things from scratch. And she was like, Desiree, don't reinvent the wheel. Every state has this funding, so they're doing some variation of this program. Call them. And I was like, I can just call them. I didn't think that it was just not in my mind that I could just call these states up and they would, give me information. I remember specifically I called Mississippi State Department of Health. They gave me so much information. They like gave me documents, processes. They gave me all of these things. And then they were like, yeah, I'll hop on another call with you if you like. And I was like, wow, like I'm not alone.
Hey friends, welcome to Public Health Careers. I'm Amari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, Dr. Desiree Strickland is founder and CEO of Strickland Health Consulting LLC and young Black and professional. She's also adjunct faculty at South University. She's an entrepreneur and experienced public health practitioner with 10 plus years of experience administering and developing public health programs and activities on the community, state, and federal level. She conferred a bachelor's degree in exercise science and another in family and child sciences at Florida State University, and a Master of Public Health at Florida Agricultural and Mechanical University, and continued on to get her Doctor of Public Health at Florida Agricultural and Mechanical University. In today's episode, you'll hear and learn more about how she became an expert consultant and tips for you to navigate consulting, talks about the pros and cons of dual enrollment in high school and why she pursued a double major in her undergrad, highlights the importance of professional development for young college professionals to find success and how she started her organization to support this. You'll also hear about the differences and experiences in studying going from a PWI to an HBCU and how she's building out her own community platform and much, much more. Be sure to subscribe and enjoy today's episode.
I'm Dr. Desiree Strickland, founder CEO of Strickland Health Consulting and Young Black and Professional, and you're listening to Public Health Careers.
Dr. Desiree Strickland, welcome to the show.
Thank you. It's great to be here.
It is great to have you, and I'm like I was telling you before, but I'll let the guests know. I will let the audience know that I'm so excited to have you on the show today. I've been following along on your journey, and you're doing amazing work, and I'm very excited to be able to sit here and learn about your journey and just take away some of those insights. So I'm really excited for this conversation.
Thank you. Me too. I'm ready to dive in.
Love it. So let's dive in. So before we get into more of your public health career journey type stuff, so how do you identify and tell us about your personal background?
So I identify, I use she, her pronouns. I'm a young African-American Black woman. And yeah, so tell you a little bit more about my background too?
Yeah,
so,
please.
Yeah, okay. So I'm from Madison, Florida. So it's a very, very small town in Florida. Whenever I tell people I'm from Florida, they always think like the palm trees, Miami, nothing like that. Like there's cows in our backyard, very rural, very country. And that's where I grew up. And then I moved to Tallahassee, where I did undergrad at Florida State University and then grad school at FAMU for both my master's and my doctorate. And of course, they were both in public health. And that's kind of how I kicked off and started my public health journey.
Okay, awesome. And I feel like things are going to naturally come up as we get going, but love to hear it. Small town girl in Florida moving into a bigger city and then really elevating her career and the work that you're doing. So yeah, I can only imagine the career path and like that thought process into getting to where you are right now, and we will dive into that. So I'm looking forward to hearing more about that.
Awesome.
Yes, but before we get into anything, as a career consultant focused on Black professionals, what are some of the main challenges you see people struggling with, and what are some of the solutions that you give them?
Yeah, so I will say the reason I even started Young Black and Professional, I started it because When I was back working in Florida, I worked for the State Department of Health for a number of years, and I was one of the administrators there. So I would always take in interns because I, was an intern once. I seen the impact of having a great preceptor and what that did for me in my career. So I was just like, I want to make sure that I take interns. And I would always make sure that I'm taking the Black and brown interns. That was one of my things. Like, I didn't discriminate. I had interns of, all, race and ethnicities, but I made it a focal point to make sure that in every cohort that I had a lot of diversity within that cohort. And I was in Tallahassee, so we had FAMU right there in their program. So why not? I noticed just the differences in the level of preparedness my Black and brown interns had. Like they would get in meetings, not be prepared, not say anything, just not taking advantage of the internship. And, after they leave, they're like, oh yeah, I hope I get a job somewhere. Meanwhile, it's other interns of other race and ethnicities, and they are landing these jobs right after. They're networking, they're doing the things, they're showing up. I had an intern even one time, in the office, we had like glass doors, right? So you could see what people were doing. They were asleep and they had Netflix playing on one computer and they were asleep in there. And I was just like, oh my God, like this is terrible. And so, since then, I was just like, I want to start something where I'm really providing mentorship and guidance to young Black professionals. And after I finished my doctorate, that was the idea. That's kind of how it was born. So one of the major problems that I think that I see a lot is I feel like them not taking advantage of the opportunities that they do have. That's one thing that I see pretty often. And then also the second thing is their resumes. So resumes are honestly, for lack of better words, trash. So it's just, and I'm reviewing them and I'm just like, okay, they're not teaching us this in school on how to do these resumes. And then even that, like I see people, they get into interviews and I've been, on the other side of the interview panel interviewing people and they do terrible in the interviews. Like some people I've had not even realize what was on their resume, and I asked them a question about what's on their resume, and they're just like, "Oh, they have nothing to say about it." And then it's just like one, we're not used to talking about ourselves in that way all the time, like we do in an interview. We're not used to doing that, so it could be just kind of lack of having that practice in that area. But then also just kind of with the resume thing, we're not used to doing a document like that. So that was, that's something that I see a lot of times. A lot of people come to me for the resume help and just for the mentorship overall. Cause I think especially in like career in fields like public health, like we don't realize all of the various opportunities that are out there other than the CDC and the departments of health. So that's kind of one of the major things that I try to expose people to, like, hey, there's so many other paths out there for people like us with our skills and our backgrounds.
Love it, love it, and I can imagine. I've been on the other side of reviewing resumes and seeing that, like, like I literally don't understand what people do sometimes. I've seen resumes where people put like their religion on there. There've been many,
Oh
many, right,
wow,
many
yeah.
resumes that I've seen, and like to your point, it is trash. But to that
Mm-hmm.
point, it's like we haven't been given the opportunity to learn or haven't been in a space to know how to do these things. And I
Yeah.
remember having a conversation with one of the people that I work with who writes some articles for me. And when she was entering into the workforce, she just didn't know how to dress professionally and like all these things we
Mm-hmm.
don't know, and just not having
Yep.
that guidance and that mentorship to enter into
Mm-hmm.
these spaces. And I think to your point, like taking the opportunities that we have and really riding with them are so important. And that's one of the biggest things that changed for me as I shifted from like my bachelor's into my master's program. I was like I'm gonna
Mm-hmm.
take every opportunity I get in this master's
Yeah.
program and really run with it. And from that, it has like really elevated my career and allowed me to do so many
Mm-hmm.
amazing things. So I think those are very, very important. And once again, I think just I appreciate you being intentional and wanting to ensure that they are interns of diverse backgrounds, being able to be in these places, and then from that experience, learning that okay,
Mm-hmm.
there are differences in the ways that these
Mm-hmm.
professionals show up, and there needs to be more done to support these professionals. As people will hear as we get into the episode, you've done a lot of work around equity. And you've done a lot of trainings and workforce development. So, can you just highlight the importance of that type of work?
Ooh, it is extremely important. I think that we're still in a space where it's not 100% accepted everywhere, right? Like we still, I just spoke last week about the in Florida, at University of Florida, how they did away with the entire DEI program, right? So like thinking about that and then what it means for health equity. And, I had a conversation with someone else last week just about how, thinking about just politics and how that plays a role in health equity and everything. And so it's just it's a lot, but it's amazing work that we have to continue, and we have to continue and really put a lot of effort into. And I think that starting out, when I first really learned what health equity was, I was at the State Department of Health, and I think it gave me an opportunity to really dive into that work, because we were just really, I think, as a department, really kind of putting an emphasis in on health equity, trying to get a standard definition of health equity, develop graphics, and incorporating into our programs, our evaluations, and things like that. So I got to kind of be on the ground level working on all of those policies and different things like that. So in doing that, it really exposed me to not only like, oh wow, this is great work that needs to be done, but in working for state government, the political landscape of everything. And it was in Florida. So it's definitely things you have to tiptoe around, things that you have to, you know, use your discretion when saying, not saying, when writing it down, not writing it down, even when within the federal government as well. You have to keep in mind the political landscape of everything. So I think that, one of the things through my consulting business that I do a lot of health equity trainings for just a lot of diverse type groups. And one interesting thing that I will say about doing that work is that you definitely have to make sure that you understand the level that your audience is on before doing it. So before I even do it, I always go in with a survey to just kind of determine just where everyone is, so I can lay that landscape. Because, you may have some people that are more advanced in their understanding of it. Then you have a lot of people who are not as advanced. And then you also want to keep in mind, the background of the people who you're teaching, because there are certain things you can't say that will just turn people off and close them off completely to the concept of health equity, the ideas and things like that. So I have to make sure that I'm always being mindful of who I'm talking to, their background, what their beliefs are, and just kind of making sure that I put it in a way that everyone can understand it. Because like whenever I go in, I like to always, and I've been using this analogy for years, I'll say something along the lines of, okay, if everyone in the audience, I gave you all a size 7.5 stiletto heel. I gave you all the same thing. So that is equal, right? I gave you everyone the same thing. But everyone can't use a size 7.5 stiletto heel. Some people need pants, honestly. Some people need shirts. Some people need a size 8, right? So just thinking about that being the concept of equity, and just kind of using other definitions in addition to race, but just using other things like that to kind of make sure that you're capturing the audience. So I think that I've learned a lot in that journey of working within the health equity space. But it's always been good, and it definitely comes with its own unique challenges, but it's work that has to be done. So
Absolutely has to be done. And I went to University of Florida for my master's of public health, so I see a lot of the posts around the DEI
mm-hmm.
issues in at the University of Florida, and I think emblematic of a bigger issue that's going on in Florida,
Mm-hmm.
as well as probably just like politically across the country. And I think it's
Yeah.
very interesting, and we're in a very interesting time to be public health professionals, to be health equity professionals, when there are these
Mm-hmm.
gag laws, and there are just a lot of actors that are trying to push us away from a lot of the things that we've tried to work towards. So yeah, it is a challenging time for health equity advocates, but definitely continue needing people like yourself and others out there pushing for the good fight. And I know recently that you started up a club, the public health club.
Mm-hmm.
I think it was what it's called.
Yeah.
Can you tell us more about that and like how that came
Yeah.
about?
Yeah, definitely. So in the beginning, like I had mentioned, Young Black and Professional, that was kind of really my start into really kind of entrepreneurship a little bit, like officially. So I decided to do Young Black and Professional because, like I said, I seen that need. And through that, about 90% of the people who I was serving were in public health. They all found me through that organization. So I did notice that, when we're working in public health, a lot of times what happens is, we're developing communities and spaces for all these other people, these populations that we're serving. We're developing their communities. We're doing all of these things for them and giving them resources, giving them guidance. But we don't have communities for ourselves, at least not as many, right? So I think that, we have our Facebook groups and then we have like a few here and there. But, I was just like, we need more. We need more spaces for public health professionals to be able to really come together, really not only come together for like a webinar or one-off training or one-off career development, but just kind of constant and contiguous providing of resources and then sharing those resources. I think one of my mentors in public health, she told me when I first got started in my career, one of the things that she told me was, Desiree, you do not have to reinvent the wheel on everything. And I was just like, okay. And the thing that I was doing at first, so when I got into the Department of Health, I was working on this grant, and it was called the 1305 grant from CDC. Every state had this grant, and it was like focused on like chronic disease prevention. And I was managing pieces of that grant, and I was literally trying to figure things out. Like I had no blueprint, we had no historical documentation. Like it was literally nothing there, and I was like trying to start things from scratch. And she was like, Desiree, don't reinvent the wheel. Every state has this funding, so they're doing some variation of this program. Call them. And I was like, I can just call them. I didn't think that it was just not in my mind that I could just call these states up and they would, give me information. I remember specifically I called Mississippi State Department of Health. They gave me so much information. They like gave me documents, processes. They gave me all of these things. And then they were like, yeah, I'll hop on another call with you if you like. And then I forgot which other department I called, but I called them and they did the same thing. And I was like, wow, like I'm not alone in this. And that feeling of not being alone, now I have all of these resources. I didn't have to create them from scratch for myself. I didn't have to do all of these things. So that really stuck with me on my journey. So whenever I got into a new position, I would always say, okay, who was in this position before? Who's doing some work that is similar? Who can I reach out to and talk to? And that has helped me. That has served me greatly throughout my career because I'm able to really get in places and hit the ground running a lot of times because I'm not trying to start from scratch. So I think that concept is one of the major reasons why I decided to create the Public Health Club, because I feel like, one, we need community with other public health professionals, and not only community to just talk to each other, just kind of level up our career, but also a community to share resources within our current career. Like, we have the Facebook groups, we have LinkedIn, but they're not structured, right? So I'm a person, I like structure, I like organization. So I'm like, okay, we need this many live events, we need this many, times where people can actually come together. People need kind of like structure and points to actually come together, because a lot of times, like, of course we're grown, we're adults, we can do things on our own, but a lot of times it makes it a lot easier for people to come together when they're coming together over a shared event or a shared problem or something that is shared amongst that community. So that's how the Public Health Club was born, out of that idea. And I had the idea to start it around this time last year. So I've been kind of planning it in my head around that time. And then really like this year, I was like, hey, this is going to be the year that I just do it. I just implement it. And so I did it, and it's gotten like, since I literally launched it like 2 weeks ago. And since then, it's gotten like so many people have joined, so many people have said great things. We've had like this past week, we had 3 live events. We had one that was doing a Q&A focused on public health consulting. And because I wanted to make sure that people were, one, exposed to that they can be public health consultants, especially, we have so many people with so many amazing credentials, so many, like, just amazing backgrounds, but they miss out on a lot of additional funding opportunities because, they may think they're not qualified or they're scared to try. So I wanted to really take the role of public health consulting and really bring that to the public. So I did free training, taught them how to do it. And then within the club space, we did a Q&A. So I had a lot of people join that Q&A, and we just really talked about it and talked about how they can get started and what are some things they can do, some marketing things that they can do and stuff like that. And then we have weekly mentorship sessions. So we had that. And what was great about it is that it's community. So it was not only me answering the questions. We had other people within there, like that were in the community answering questions. We had people on senior level at like CDC and like all of these people in there. And we had like DrPH students, MPH students that were asking all of these questions. And it wasn't just me answering. And that's what I love the most about it. It wasn't just me providing the answers. And that was what I've seen for this community, for everyone to be able to give guidance, because for me, I'm a person that, like, I have my opinion, but I'm not the only opinion. Like, I want other people's opinions to come into play. But that's kind of the reason of why I launched the Public Health Club. And I also have a course called Subcontracting the Six Figures that starts March 18th. So it's for people who are interested in landing contracts, but they don't really know where to start. They don't really know how to start kicking off their consulting business, their consulting side hustle, whatever they want to do. So that's the course dedicated to teaching them how and really walking them through it.
Awesome. Well, I'll be sure to link all of those in the show notes for anyone that isn't interested in joining. And don't be surprised if you see me in that community as well.
Awesome.
I think it's really important. I feel like especially the pandemic has taught us just how important community is, and how we can create these community spaces online, and just as to your point, like just creating structure and just creating opportunities for people to connect, whether that is around public health consulting type stuff or just around like life stuff. And some people might know, like, I've also launched my community, but I think it's never a zero-sum game. I don't lose anything from you having a community. You don't lose anything from me having a community. And I think it's important that we all have our communities, because they're all different spaces that people can come and feel seen and be a part of that community. But going back to your other point that you also mentioned was around not recreating the wheel. I didn't want to lose that, because I think that is important, because many of us come into new public health roles and we're like, oh my God, I need to do all this work. But then many times there are people who have done this before us, who have the groundwork, who have the foundations, or there are people in other states or other cities that are doing similar things that we can create relationships with and learn. And as you said, people were willing to share with you. And many times we disregard that, or we don't acknowledge that that's a possibility. So I'm glad that you mentioned those two things. And I have a lot of questions to ask you about consulting, but we have a lot of things in your journey to get to before we get to that. And before we get into your public health journey, what does public health mean to you?
Ooh, what does public health mean to me? Public health, the number one thing that comes to my mind when I think of public health is community. Is, just having an opportunity to really bring people together, to really congregate over something that is shared. So that's the first thing that comes to my mind when I think of public health. I think that I like to say that public health kind of found me, because I think that, like a lot of people in public health, my goal was med school at first. So it was medical school. That was going to be it all the way. But, as I kind of got through those courses, it was just like, I don't know. So I found public health because honestly, like, I wanted to I thought it would look good on a med school application to do an MPH. And I knew I wanted to go back to school, but I didn't know what for. And it seemed like a good move. And then through my classes, I literally fell in love with the idea that I could actually build something that could affect thousands of people versus just, interacting with one person on a one-on-one basis. So I really fell in love with that idea. And that's kind of how I stuck with it.
And now for a quick break. Are you ready for the nation's largest convening focused on global Black maternal health outcomes? Well, lucky for you, there's still time to register for the 2024 Black Maternal Health Conference, hosted virtually by the Center for Black Maternal Health and Reproductive Justice on Friday, April the 5th from 9 a.m. to 5 p.m. Eastern. Hear from some of the leading experts on Black maternal health while building a network and connecting with like-minded folks. The theme of this year's conference is centering the role of technology in addressing Black maternal health disparities. If you register, you also get free access to the virtual and in-person premiere of Black Motherhood Through the Lens of Film, an award-winning documentary centering the birthing experience of 4 Black women navigating the reproductive and maternal healthcare system from conception to postpartum. Sign up today to be enlightened, inspired, and empowered at thephmillennial.com/BHMC. That's thephmillennial.com/BHMC. Or click the link in the description. Now back to the show. Love it, love it. Not an uncommon story, generally
Yeah.
speaking, but I think an important one, especially
Hmm.
when like I look at someone like you, who I feel like has accomplished a lot in public health, who I look up to in a lot of ways in public health. It's really important for us to share that we had challenges with classes because people think like we're good at everything or like everything just goes our way, but that's not the case. And I think it's important that we highlight those parts of it. So you started off your undergrad journey and got your bachelor's degree in exercise science and another in family and child sciences at Florida
Hmm.
State University. Tell us about that thought process.
Yeah, so I feel like when a lot of people hear I double major, they're like, "Oh my gosh, she's so smart." But so it happened because and when I was in high school, I did dual enrollment. And so I came in Florida State with a lot of credits already. So I had like maybe like 50 something credits. So it was a lot. And having like almost finished half of my college career when I got to college, it was just a lot I didn't know if I wanted to do, right? So I didn't know if I wanted to go to med school. After I got into the courses, then I started taking like calculus and organic chemistry and physics, which I barely passed through the skin of my teeth. When I started taking those, I was like, if this is what med school is like, I don't know. And I wasn't 100% ready to be out there on my own. So I was just like, okay, I think that I want to go ahead and just double major because I don't want to graduate early because I think that I still have a lot to get out of college. And then, like I said, I just wasn't sure on what that next move should be for me because I wasn't even, I think I switched my major like 5 times when I was at Florida State because I came in as biology pre med. And, I switched to, I think, psychology at one point. I switched to exercise science. Then I switched to family and child science. And then I think I realized I could just double major in both. And so like I did that and I really loved my family and child science courses. And I remember thinking in my head, like I wish I could just merge like family and child science and like healthcare. And I feel like that was public health basically. It was a part of public health and I didn't know that at the time because we didn't have like a public health undergrad degree there. So I didn't know like what that would look like. So just kind of through that, I was just like, okay, I'm going to go ahead and finish out undergrad. I ended up graduating in 2014 from undergrad, and I actually worked as a medical assistant right after. And I think a little bit before, probably, I worked as a medical assistant. And that was me trying to really still decide if I wanted to go to med school. So it was a small family practice, and I was literally right underneath the doctor as he was seeing patients. I was scribing. I was doing all the things and I loved it, but I still wasn't completely sold on the idea of I want to be a doctor. So just kind of kept doing that. And like I said earlier, like that's when I found the MPH program and I applied to it and I got in and I went there. But even like through that journey, like you had mentioned, like I think that a lot of people don't see the struggles because, we are talking always about the accomplishments and things like that because that's what people like to hear, right? So, but the struggles, they're there. And I feel like, I try to talk about them too, because I remember taking a practice MCAT test at Florida State. So they had them set up where you could go in. They structured it like the whole setting was like the real test. I got in there, I took a practice MCAT, and when I thought about cheating on the practice MCAT, that's how I knew. I was just like, I was in there stressed. I was just like, let me look over my shoulder. I was like, yeah, Desiree, this might not be, this might not be the right move just yet. So yeah, I mean, having like, that be a part of my journey and then struggling through like, those hard science courses that are meant to like weed you out, of course. That was a lot, but I think that it was all in helping me to find public health.
Love it, love it. A lot in there. I think the first thing I heard was like the dual enrollment, and I think you kind of highlighted the duality of it because while it's helpful in
Mm-hmm.
getting you into college and like really helping you to accelerate your path in college, it also on the other side of things doesn't give you the time to really develop maybe as a professional, as a student, to really understand
Mm-hmm.
all the things that you're able to do. And in
Oh
doing
yeah.
that, you're like, okay, I could finish in 2 years, but let me really get the college experience. Let me really like find out
Mm-hmm.
what are the things that I want to do. And I think like that even goes into you wanting to work as a medical assistant and really
Mm-hmm.
just like ensuring, hey, okay, I think I want to become a physician. Let me get
Yeah.
that experience and really figure that out, which I think is important. I wanted to ask you like more specifically around because you said that you're in Madison, Florida, which is decently close to Tallahassee, but a small town.
Mm-hmm.
What was that like? What was that like going from Madison Ford to Tallahassee? Because I know Tallahassee is a pretty crazy place to be to go to school.
Yeah, it was. I would say it was definitely different. I think that when I first got to Florida State, I always describe it as a culture shock. Because I think that going to like my high school, like our town, we had one high school, and everyone went there, so everyone knows everybody. And so when I first got to Florida State, I was in this program called the CARE program. It was for first generation college students. And so I was in that program, and it was a lot of, minority students in there. It was people that looked like me in there. So I felt very comfortable. It was great. And it was over the summer, so it wasn't as many people on campus. And, when I got to Florida State in the fall semester, I remember going on campus and I remember just being overwhelmed by the amount of people that were on campus. Like, I remember looking around and I didn't see anyone that looked like me. And I was just like, where did everybody go? We were all just together for the summer, but where did everybody go? And I felt an immense culture shock. And then also when I was in some of my classes, like, you going to like UF, you went to a pretty big school as well. Like those classes, some of them were huge. Like I remember like having hundreds of students in one class. And of course the professors, like they did the best that they could, but they couldn't help everyone all the time. So I didn't really get individualized attention. Like I was somewhat used to having coming from a very small town, in a very rural area. So I think that one of the things, like I did feel behind a lot in some of my classes. I remember feeling behind in like general chemistry, just because like coming from my school in Madison, they did not prepare me for chemistry. Like I was not prepared at all. Like I took a chemistry class in high school, but I don't know what they taught me in there, because when I got to Florida State and took chemistry, they were speaking another language. And I was like confused. And then I felt intimidated to ask for help a lot, because I would have some classmates who, some of them went to like these really great high schools and they had all this money, and, they were just like, oh, we learned this in high school. And I was just like, oh, okay, well. So, it was very intimidating in that aspect of having that. And then I remember like I would go to office hours and it would be like 10 to 15 students in my professor's office hours. So like he's going around like asking, like helping them. And so like I remember asking him, I said, I'm just not really understanding this. And literally he just like, oh yeah, just do the problem and then I'll come back to you. And I was like, nowhere to start doing the problem, so it was a lot of that. Like I felt behind, and I think that class I ended up dropping it, but I ended up taking it again. And I did pass it. I did better, but I was like getting by in some of these courses, especially like the physics and chemistry and stuff like that. And I think that I didn't have as strong of a foundation as a lot of the other students, that they did. So I think that was, just a big difference. But then kind of it was interesting too, the transition and going from a PWI to a HBCU, because then I got to my master's program, and of course those courses are smaller, but my professors, like they cared so much. Like they knew my appearance. They like knew everything that was going on with me. If I didn't show up fully, like if I wasn't there, they're calling me on my cell phone. Like it was literally, and I still keep in contact with them today, so it was just completely different.
Well, firstly, thank you for being transparent on that. And I think it's important
Yeah.
once again for people to like hear that from your perspective, that it was a
Mm-hmm.
challenge making this transition into this big school, as well as I feel very similarly in the PWI. I only went to
Mm-hmm.
PWIs, and in conversations that I've had with people who've either only went to HBCUs or went to HBCUs, just that difference in the culture of how you are supported as a student
Mm-hmm.
of color is just fundamentally different. And so definitely advocate for the HBCUs out there. So I appreciate you
Mm-hmm.
sharing that. So were there any undergrad takeaways that you wanted to share? And then can you give us the path that you took to get to the Masters of Public Health at Florida E&M University?
Yeah, so I think that my biggest takeaways from undergrad, I had an amazing undergrad experience. Like, regardless of the classes being hard, like that was just a part of it. But Like I love Florida State, like love Florida State. And I had the best time at the most amazing people who I'm still friends with to this day there. I think that one of the biggest things in undergrad that I would give advice to anyone on is make sure you're getting involved. And that can look different, in different ways. It doesn't have to be joining a Greek organization. It could just be, joining any type of organization that is out there. They have so many student organizations. Joining that, getting leadership experience within those, because those are things that you can talk about in a job interview too. So it doesn't have to just be you have work experience. Like, no, you have leadership experience. You develop community service projects. You did these things. Like, and I was doing a lot of those things too. So even some of them, when I got my first kind of like job in public health, I was able to really talk about it. I was able to really talk about it in my first job interview. And I think that was big for me, being able to talk about that. And they were just like, wow, oh, wow, I didn't know that. And then they were actually interested in getting into the university space and partnering with student organizations. So it was a win win. But, just kind of thinking about that, making sure that you're getting involved, making sure that you're just being aware and you're exploring all of the possibilities. Because, like I said, I came in with the thoughts of med school, but I ended up changing and I wasn't sure. And it's okay not to be sure. And I feel like that is the perfect time, and everybody, just about everybody there is not sure at that point. Like they're doing something that they thought they were going to do, and I would say majority of people are not sure, and you're not alone in feeling that. So I think that's huge, and that's some kind of like my key like takeaways and advice for undergrad students. But kind of moving like to like me getting into the MPH program. So FAMU was actually the only school I applied to. I don't recommend that at all. Like I always tell people, apply to multiple schools. Don't be like me. Just don't do it. And then Florida State was the only school I applied to too for undergrad, and it worked out. But it was I definitely didn't recommend it. Don't recommend it. But I think that even going from like the school that I went to from high school, like they put it somewhat of an emphasis on college, but it wasn't a big emphasis. And the only reason I feel like I went to Florida State was because we had a program called the Stride program, science students together reaching instructional diversity and excellence. And it was through the Florida State University College of Medicine. And within that program, they would come out, like they had like middle and high school students, and they would like literally teach us about anatomy and physiology. The whole goal was to get us to go to medical school. And they would come out and they did so much more than teach us those things. Like we had like, field trips. So we would go up to Florida State, and, one of the things vividly in my mind is like they took us to see the cadavers in the basement at the College of Medicine. And then they would take us on trips to like Atlanta, and stuff like that, and just expose me to something totally different that I'd never been exposed to. And they even helped me with my college application to Florida State. So, and I remember like one of the mentors there, like she was just like, okay, and I think this was like probably like on the cusp of like I think you could submit your application online and you could still mail it in. So like she actually took my application up to Florida State and submitted it for me in person. And it was just having that support really like just like, okay, this is where I want to go. There's no other options. This is where I want to go. And if I didn't get in, my option was the community college. I was going to finish up at the community college. I was doing dual enrollment, and then I was going to transfer into Florida State. That was the plan. But getting into FAMU, like I applied to the program. I didn't know a whole lot about the program, but I ended up talking to Miss Gloria James, and she worked on like admissions for the MPH program. And when I tell you, just like even talking to her on the phone was just amazing. Like she was just warm, welcoming spirit, and it was just so nice, just like talking to her. And I was concerned about my GRE scores because, like, I think that I may have been like 5 points below where I needed to be for what they recommended for admission. And I was like, should I take it again? And she was like, don't worry about it. And I was like, are you sure? She was like, yeah, don't worry about it. I was like, okay. And so, then I got accepted. And I really do feel like, it was just really great. Just kind of getting into that program. And then once I started taking the classes, like I started meeting people and really getting to know. And I'll never forget, like on my first day, and this kind of goes back to the culture differences. At Florida State, we would wear pajamas to class sometimes. Like we're just sweatpants, pajamas, like we're chilling, right? At Florida State. And, then I got to FAMU, and I remember, I think we were at orientation, the new student orientation for MPH program. And I showed up with I think I had a Florida State hoodie on. I showed up with a hoodie and probably some sweatpants or some jeans and some sneakers. And the professor, who's I think the dean of the program, I think it was Dr. Harris, she was just like, so when you come to class, you dress professionally. You dress business casual, no sweatpants. And I was like, oh, I'm the only one with so I just kind of looked down like, oh God. But she was just like business casual always. And I was just like, okay. And at first it was just like, but you know, that's how you have to dress at work, business casual. So it was preparing me, but I didn't realize that. But it was definitely just a difference in how, you know, how you're expected to show up there. Mm-hmm.
Love that, love that, and I think that's important. And just having those mentors and all those little pieces of support from different people along your journey, as well as thank you once again for sharing like the challenges with the GRE and you worrying like, oh my God. And thankfully, many schools don't ask for GREs much anymore, but I think like the transparency in that is just important for people to know once again. So what was that journey like from you? Because you said you entered the MPH program initially, still wanted to go to medical school, still wanted to become a physician, and you shared earlier like the classes or like the knowledge that you were getting really shifted your perspective from like individual treatment to population level things. So tell us more about that transformation and your mindset.
Yeah, definitely. So when I started the MPH, I was still working as a medical assistant. So I worked throughout the entire MPH and my DrPH program. I worked pretty much full time. And I think that through that, you know, I was still, you know, working. So I would have to come to class sometimes. And I had to even ask my professor, I was like, is it okay if I come to class with my scrubs on? Because I'm coming straight from work. And they were like, that's fine. But I think that, you know, having that perspective of working straight for a primary care physician. And he was a great, like when I say his patients loved him, and he was definitely one of those doctors that you would be in the waiting room for a very long time. You probably get mad at the medical assistants like me, like and the nurses, take it out on them. But then once they got in the room with him, they were just like, "Oh, it's fine. I'll always wait for you." And you know, and we're just like, "Okay." And but you know, he took his time and he really talked to them and he really got to know them on like an individual level. So he knew like their backgrounds and he was able to really connect and talk with them. And I really thought that was amazing. But even still, like, you know, I had that inkling that I don't know, right? So I think that once I got into public health and I got into the program and I started really learning what public health was. I think that, you know, I took one of the first classes I took was like environmental health, and then we took like an introduction to public health course, and I think behavioral health, health education, those courses. Once I kind of took those, and I think especially when I took behavioral health, it really unlocked a part in my mind that was just like, oh wow, like, you know, there's theories in here on how to change people's behavior and how to get them to do these things. And I think that being in that program made me realize a lot of things just about my past, like disparities, you know, like things like racism, even that happened to me, and I didn't know it because I didn't know what to call it at the time, and I didn't know what it was. I just thought, you know, hey, that's not fair, right? So, and I just didn't know, but I think that having that course, like they taught me that racism isn't just somebody doing something to somebody else, right? You have structural racism, you have all these things. And I was just like, wow, like my mind was just like, oh, like, you know, I didn't recognize that it was this bigger system of things that was at play here. And then so like it allowed me to just kind of recall some of the things that happened to me on my journey, like my educational journey, even like in high school, and how like just like one quick story, like I had a guidance counselor. So and taking the dual enrollment classes. When I first started, it was me and a friend that took it, me and another Black girl. So we were taking, we were like, okay, we're going to do dual enrollment. So we went to our guidance counselor, because that's who you go to talk with about that and get enrolled. And she told us, she was just like, oh, well, the classes are really hard. And, you know, you should probably just take one class, see how you like it, see what happens, and go from there. And we were like, okay, that sounds reasonable. And you know, she told us it was really hard, and we were both, me and her, were both in the top 10% of our class. So we were just like, okay, well, we'll see. So we get into the actual dual enrollment course at the college, at the community college there, and what happens is now we see a lot of our other colleagues who didn't look like us, our other white colleagues, and they're like, "Oh, so glad you're in here." You know, we're talking and we're like, "Yeah, we're going to study after this class." And then they're like, "Oh, well, we have two more classes after this." And we're like, "What do you mean you have two more classes after this?" And they were like, "You're not in the program?" And I was like, "What?" We're like, "What program?" And they were like, "Well, it's a program specifically for high school students. And you know, you're taking three classes over the summer, and they're like, you know, guiding you through it and everything." And we were like, "Where did you hear about this?" And they were like, "The guidance counselor told them about it." And she didn't tell us about it. And so, you know, just so happened we're the only Black students who were interested in it. So, you know, that was, and looking back on that, I'm like, wow, that was a perfect example of just kind of how things, like when people get into, you know, places of power, and they're able to really dictate how someone's life can like really occur. So after that, I took it into my own hands. I said, "I'm going to be my own guidance counselor, and I'm not asking her for anything." So I just kind of, you know, we enrolled in the classes ourselves. We figured out how to do it and what we needed to do. And we went from there. But it was instances like that, and just other instances that I could think back to when I was younger in school, that this, I think that being at FAMU, being in the MPH program, learning about health equity, learning about disparities, injustices, and different things like that helped me to actually see, oh wow, this is what happens. And you know, it helped me to say, this is what I want to do with my life. This is the career path that I want to take, because now it happened to me, and I know it's happening to so many other people. And if I can help that, I can speak out to that, I'm going to do it.
Very, very important, and very similar path to me into like wanting to be a physician, going to MPH program, then realizing that they are like these health inequities, these things that happen that we kind of like see, but we just
Mm-hmm.
don't, as you said, don't have the words for, don't have the framing to understand like this is a systems issue, this is a public health issue, it's a health equity issue.
Mm-hmm.
And that's why like one of the reasons I love doing this podcast, so that we can continue to share public health, so people can know about it way before get thinking about an MPH program, so they're just knowledgeable. And then even so, like getting into MPH program is only half the battle. You have to figure out like what you want to do with your MPH, and then public health is such a broad field, so there's so many things in
Yeah.
that. But that's why it's so important to have these conversations. And I am not, I guess not in disbelief, but also in disbelief around that guidance counselor, and just thinking about how people could like intentionally set up barriers to us in our lives, even if we don't know them, even if they know we're doing well, they still can intentionally or unintentionally like block us from all the things that we are capable of doing and all the achievements that
Mm-hmm.
we're able to do. So shout out to you for like, well, I'm glad that you found out, and then I'm glad that you advocated for yourself, and you're like, yeah, forget that guidance counselor, I'm going to deal with my own guidance from this
Mm-hmm.
point going forward, which is important, and I think to the bigger point of like, how do we get more people like ourselves that are willing and able to advocate for the people that are in the margins to be in these
Mm-hmm.
positions, to take up these spaces? That is
Yeah.
important, and that is like the part of like representation in this work that is so important.
Yeah, definitely.
So you graduated from your MPH program. Did you go straight into your DrPH, or did you? Because
I
I had,
did.
you did.
Mm-hmm.
Tell us about that thought process.
Well, so I wanted to just get school over with. So I knew that
Fair.
I was already in motion. So I didn't want to stop. I knew I wanted to do the DrPH program. I had been talking to my professors about it. And again, family was the only program I applied to. So it
And
was like I said, don't recommend it.
and how did you know that you wanted to do a DrPH program? What was that?
Yeah. So since, you know, I wanted to be a medical doctor since I was a kid, basically. I wanted to be a pediatrician. So I knew I wanted to like go the highest level I could go. And I think even like, you know, back when we had like these, you know, crazy little email addresses, like my email address was future Doc Jonas. So it was like already like, you know, I put it in the atmosphere. That's who I would be. And I think that, you know, going to the DrPH, it felt natural for me to just like do it, because I knew I wanted to do this. I knew public health was what I wanted to do with my life. And so I was just like, okay, I'm going to go for it. I talked with my professors about it, and I went for it. And I think so at that time, when I think about probably like the semester before I graduated with my MPH, I got a job at the State Department of Health. So I was a heart disease and stroke program manager. I got like my first job, so I quit being a medical assistant and went on into, full time there. And in that job, like I really enjoyed it, and I was able to incorporate a lot of the stuff that I learned in school into what I did. So like the theories and stuff that I learned, like I was like, okay, let's see if I can implement it here. And so it was really great in doing that. And then also just talking with my employer, like, they were very supportive on my like journey to get my DrPH. And they were like, oh, we can flex your schedule out. So if you have class, you can do this, and everything like that. So that was another win for me. So I would have a flexible schedule. And then I did apply to different fellowships and scholarships, and before getting into the DrPH program. So I was able to receive the McKnight Doctoral Fellowship. So that one is specific to Florida residents, and it was for, minorities who are interested or going into a doctoral program. So they fully funded my DrPH. They gave a stipend probably of about $6,000 a semester. And yeah, so I mean, I think that having that, and then I was actually as well. I think that at that same time I had got awarded so it was American Public Health Association. It was like a maternal and child health fellow. So I had became one of their maternal and child health fellows. No money associated with that one, but it was really great to say, okay, they awarded me this fellowship. So now I got a lot of guidance because my area of interest was maternal and child health. So it was, having both of those things. And then also having just the supportive community of my professors who I knew. And then just, having a supportive job that, really advocated and wanted me to get my DrPH, having my boss who advocated for it, because I think my boss, she had at the time had like, was about to or had just defended her dissertation at the FAMU DrPH program. So she was definitely an advocate for it. So having all of those things made the decision really easy to do, and then even easier to do it at FAMU.
Well, yeah, I appreciate you sharing that, and shout out to everyone that supported you throughout that journey. If there were like maybe a couple of things what would you share some differences maybe between like the MPH program and a DrPH program, just for someone that might be thinking about doing a DrPH but isn't too sure?
Yeah. So I feel like I get the question a lot of like, oh, was it hard? And the classwork is classwork. Like I think that the classwork it wasn't like more hard than an MPH classwork. Like I think that the hardest part for me, like because I don't like it, is statistics. So like that was the hardest part for me. The other ones, they were just classes. It was kind of like a continuation of the MPH, I felt like, because I was taking like different types of classes, but they were all kind of around the same thing. And if you really love what you do and you really love public health, then the classes aren't that bad. Like it's work, of course. And you're gonna have sleepless nights, like you're gonna be up writing papers and doing things, but it was more so like a continuation. I would say the hardest part got to when I started my dissertation. I think so. One of the stories I always tell people is when I started my dissertation, or when I was about to, after I passed my comprehensive exams, I went into dissertation, and me and one of my colleagues, we were burned out. Like me and her had both did like MPH and went straight to DrPH, so we were like in it together. But her track was more epi biostats, and I was behavioral health education, but we still had some overlapping courses. But we were burnt out like to the max after our comp exams, and we decided to kind of take like the rest of that semester and just like relax. So we didn't even write for our dissertation. Like our advisors were like, "Hey, when are you gonna write? When are you gonna?" And we're like, no, like we're just gonna kind of take a little break for the rest of the semester and then pick back up in the summer. And that's what we did, and they were fine with that. That's what we did, and that mental break helped us a lot because we came back and we were fresh and we were able to go. And I think that that's so important because you can't get burnt out with school and with all these things, especially with we both work full-time jobs. So it was a lot. And I think that once you got to the dissertation phase, the hardest part was just kind of keeping your schedule. Like, because it's not a class, like you determine when you graduate. That's why, like, you see so many people that it's taking them 10 years to get a PhD, and, it's taking other people like 4 or 5. And it's because you determine your dissertation. Like, you determine when you're collecting your data, like how you design your stuff. And it's up to you to get all of these things in and done at a specific time. So I think that was one of the hardest part in just that transition from having to keep my own time and do these things and write and everything like that when I didn't have a structured class and someone telling me, oh, you need to do this by this and this and at this time.
Yeah, well, thank you for shedding light on that. I think that's important, as well as like shout out to you and your friend for like realizing that, hey, like we need to take this break and like advocating and being able to take the break. And I guess shout out to FAMU for allowing you all to take that break on that dissertation and come back fresh, because
Yeah.
as we know too often in public health, people do get burnt out, and we don't set ourselves apart and say, okay, let's stop now before we get burnt out. And I think it's an important
Mm-hmm.
place to be and
Yeah.
mindset to have in public health. So appreciate you sharing that. And as you're sharing that, you said you were working full time. So you said that you moved into heart disease program manager at Florida Health. I think during this time you also got a promotion as a heart disease and stroke program administrator at Florida Health. And you also worked as a senior manager for the Child Health and Wellness, Georgia SHAPE, and Georgia Department of Public Health. So tell us about that.
Mm-hmm. Yeah, so at the Florida Department of Health, the State Department, I think that one of the things we as public health professionals, we're so used to wearing all these different hats. And I think that just starting out in my career, it was amazing. One, like I said, I was burnt out, I was tired. But what that position allowed me to do, like, it was amazing. I don't think I would have got that anywhere else. Or, maybe I would have got it at another, like, Department of Health and everything. But I am just so grateful for that experience that I got, because I was able to not only like lead my programs and like develop them and do the things that I wanted to with them, but I was also able to present at conferences. Like, they paid for me to travel everywhere and present on behalf of the department. And so I was like presenting and presenting my work and doing all of these things and making connections. And then, of course, beefing up my resume too, because now I'm presenting and doing all of these things. And then I was able to get training in various areas. So through that, I was able to get training in GIS. So I was able to do all of these amazing just things. And of course, it was a lot. And then I was also the program person. I was the evaluator. Even though we had like evaluators, their bandwidth was cut short on things that we had to evaluate for our funding and other programs that we just had that we didn't really necessarily have to evaluate, but we still needed to. So those I had to do on my own. And then also just kind of like I was training people. I had a team under me. Once I got to being the program administrator, I would do the hiring in the department. So I'm doing like performance plans and all of these things for my employees, taking in interns. So doing all these different things. And I was the grant writer. So I was writing grants at the time. And it was a lot, but it was really amazing to do all those things and unlock all those skills that I didn't really know I had, and to be able to get better at them. Because of course, like when they first was just like, yeah, Desiree, you're gonna lead this grant writing team. And I was like, lead? Like, I'll be on the team, but what do you mean lead? And so that was an amazing experience in itself, like just being able to lead a grant writing team. And I think my supervisor was supposed to do it, but I think that she ended up getting sick. And so like she was out for like a couple weeks at a time. And so I had to do it. And it exposed me to grant writing. And so just kind of having those experience within the State Department were amazing. And I think that one, it does also have a lot of problems. Like I will say the pay was low. The pay was very low. And that wasn't great, but the experience definitely made up more for that, I will say. Especially like I said, just starting out in my career. So before I finished my DrPH, I ended up moving to Atlanta. And I got the job at the Georgia Department of Public Health, and again, another state department here in Atlanta. And I was working definitely, I feel like I've had the amazing opportunity to have some amazing bosses. Like they've just been amazing. And even moving to the Department of Public Health, my boss there, she was amazing, and I learned a lot from her. I didn't stay there long. I think I stayed there for maybe like 9-10 months or so. But it was a great experience. And one of the things that I did say I took away was that a lot of state departments have a lot of similar issues and problems. As far as I would say, just not being up with the times on, how we do things and processes and expediting processes. Things move extremely slow. And that's definitely a barrier, challenge that I see that we face often. And yeah, so I think that I got a lot out of all of those positions, and I was able to really develop some really strong leadership skills in doing those.
Right. I appreciate you sharing that, and I think it's important, I guess, to highlight the point of maybe always not being in a position where you're getting paid the most, but you're able to like do a lot of things. And that's where I think the
Hmm.
trade-off is, especially when you're early in your career. Like do the things where you can get the experiences that you can talk to and really as you're saying, like figure out like what you like, and like you're doing
Hmm.
everything from program management to evaluation to grant writing to everything in between. And I think being in that position, getting that experience is invaluable, and it's probably worth a lot
Hmm.
more than just like the monetary value of it. But once
Oh
again,
yeah.
I'm definitely here to advocate for people to get paid well in the roles that they do.
Oh yeah.
But understanding that sometimes you have to have that trade off of getting the experience and working more to then
Oh yeah.
be able to level up and get that pay and get the jobs that you like and appreciate more.
Yeah, definitely. Because I feel like, a lot of times people just graduating, I definitely see them coming out of like their MPH a lot of times. They're like, oh, I want to make 100,000. And I'm just like, well, where's your $100,000 skills? Like, tell me, like, what's on your resume that's worth that? And because that's what jobs are looking at. Like, it's great to say, like, and I feel like, I'm definitely an advocate, of course, for being paid what you deserve and being paid well, but definitely being deserving of that and having the skills to back that up. And a lot of times, I think that one, public health is a lot of times when we are known for having low pay in a lot of areas. But that is one of the reasons why I always try to tell people too about like the more non-traditional public health roles as well, because there are so many organizations out there that are not public health organizations, but they're doing work that we're trained to do. Like I had seen a job posting for DoorDash the other day, and they're looking for a social impact manager. And I think they were paying like 150, like something $1,000. And I'm just like, look at social impact manager. That's us. Like, we can do that. So just kind of thinking about like, there are a lot of other routes, but I think building that foundation and getting those skills is just key. Like you got to have those skills. And then if you're in a place that lets you do all those things like I was able to do, get all the skills you can, do it while you can, and then get out. Don't stay there for 20 years. Like get the skills, feel like you're good in this area, you're an expert, get to the point where you feel like you can do this in your sleep and leave.
Yeah, completely agree with that. So I appreciate you sharing that. So did you have any DrPH takeaways that you wanted to share with us?
Yeah, so I think that one important thing I would say about the DrPH, you're going to make some amazing connections. And all these people, your colleagues, are going to be doctors of public health. So they're going to go work in various organizations, CDC, NIH, like all these organizations. And it goes back to that concept of making sure that you have community. And I think that that's one of my key things, because when I do my consulting on the side, like of course, like if I can't do something or if I don't have these specific like skills that they need, I have friends I can call that have those skills, that have like so much experience, and I can place them on the contract with me, right? I can place them as one of my subcontractors. And it's amazing to just have a network where they're just literally a phone call away. And they're doing, like I said, some amazing things. And so I think that that's one key thing, is to make sure that you are making those connections. You're, I guess some people call it networking across. So you're networking across, not only looking to network up, but doing that as well. And then I would say too, like if you're like me and you don't have much experience, but you're going to a DrPH program, try to work. Like I know it's a lot, but like try to work while you're doing it, because what you don't want to happen is like you come out, you have this doctor of public health or this PhD, but you have no work experience. Because that's going to really hinder you in finding a job. Like it's rough, it's hard, but I think that it benefited me greatly to do that, because not only do I have the credentials, I have the experience to back that up too. I have the practical application of the practice that I've learned. So I think that that's also important. I think that one key thing to remember that I was told when doing my dissertation work was, your dissertation will not change the world. You just need to graduate. So, and I think that I was extremely passionate. Of course, I think everyone's pretty passionate about like their dissertation work or their thesis work that they're doing. And I think that we have to definitely think about, okay, we just got to graduate. You just got to get out of here. You can do more research. Like you can do more research. You can do more things. But for now, you just need to graduate. So like, adding in all of these different things, all of this, like these protocols and stuff, they're great. But are you trying to graduate now? Or are you trying to graduate in 10 years? So I think that's one practical tip that I really took away from that program.
Love it, love it. And I think those are all important, and people should definitely consider and take those into consideration when they are doing a DrPH, and as well as like an MPH. Right? I think those are also applicable to that as well.
Yep.
So you graduated and you became a health policy analyst too at the CDC. Tell us about that.
Mm-hmm. Yeah. So I was actually, so once I finished my DrPH, I think I had finished my DrPH while I was working at the Department of Public Health. I'm in Georgia. And I said I worked there for about 10 months, and then I found the new role. And it was actually a contracted role. So I was contracted through a management and consulting agency to pretty much be full time within CDC as health policy analyst in their division of heart disease and stroke prevention. And I think that one of the things I loved about public health is just the different things that you can do with your career and how broad public health is and how intertwined everything is. Because being a program manager, I went from being a program manager to someone in policy. And one of the reasons why I wanted to go into policy was because I've seen that a lot of things can't move unless policy changes. A lot of things, policy dictates everything. So that's why I wanted to actually go into policy. And I was just like, well, I could, get a certification or blah, 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 or I could tweak my resume and I could just apply to jobs and get on the job experience in policy. And what I did. So I applied for the role. I think I seen it on Indeed. I seen the job and I applied for it, and they actually reached out and said I didn't get, like, they did have like an automatic message that said, "Oh, sorry, we're moving on." But then the next week I got a call and said, "Hey, we want to interview you." So I don't know what they had going on, but they hired me, and I started as a health policy analyst. And when I tell you I worked with some of the most amazing people, they were amazing. And you get to CDC and then you see how smart people are. Like it's so many people. And I think that's of course any organization, but it was so many people who I interact with that, they were MDs and just PhDs just everywhere. And I was just like, oh my God. And then these people were just amazingly smart. And I think that was like a great thing of me seeing, but then also the connections that I was able to make and just continue, because some of the people there, I actually were my like project officers when I worked for the state Department of Health. So like their names, like I seen them, I talked to them one-on-one when I was working for the state, and now like they're like, oh, Desiree, yeah. And so, still having those connections was really important for me too, and was something I was able to still continue to this day. But I think that, so with working in policy, I realized after about a year, I didn't like it. So I realized I was just like, oh, so this is what it is. So I think that the exposure that I got was what I needed. Having that skill now in my back pocket, and being able to look at things a different way, was a key takeaway that I got from that position. So I went from there. So within the management and consulting firm that hired me, they decided to bring me in full time as a project manager. So I was managing now CDC projects. And that came about because I was transparent with my boss. And, I was thinking about leaving. I was actually applying for other jobs. And she actually, so it's a small management consulting firm. It's large in that they make millions of dollars, but it's smaller compared to like the Guidehouse, Deloitte, like all of those. But she, like the CEO was like kind of like managing that project a little bit. Like she had a project coordinator under her managing it, but she was very involved in that project. And she asked if she could take me to dinner one day and just talk about how things are going. And I was like, yeah. She was like, yeah. And I was like, okay. So she took me to like this country club, and I was just like, oh, I'm in a country club, it's fancy. So we were there, and I was nervous, but we were having lunch, and it was really great. And she really asked me, she was just like, so how are things going? And, what do you want to do next? And everything. And so I was very honest. I said that honestly, like with this job, it's great. I love the people, but I don't think I want to do this anymore. And she was like, okay, well, what about project management? I can bring you on. And I was like, what? And so, and at the time, I think I was pregnant with my daughter at the time. And so when she said that, I was just like, okay. So she was like, yeah. So after you have your daughter, we'll just transition you and just bring you in full time after your maternity leave. And I was like, really? And she was like, yeah. So so I was just like, okay, well, that'd be great. So she did just that. Like she brought me in as a project manager. So I was actually managing now that project that I was working on with CDC. And then some other projects too that I managed with CDC. So that even brought a whole nother perspective to my lens of like consulting and management, because now I'm like managing contractors, and I'm managing like, even like we had like some like short term people that are working on contract short term, and they had their own businesses and consulting businesses. So now I'm managing them, and I'm looking at the hourly rates that these people are charging, and I'm like, oh my God, like what? And y'all like, we're paying? So I was like, yeah, clearly this is where I need to go. so, so just having that exposure, being able to manage that, understanding too. I think one of my biggest takeaways from that was just understanding the importance of relationships, because that is big in even landing the contracts, continuing to get contracts, the relationships that you develop, and your reputation, of course, in public health, because the public health world is small. Like it is so small. Like literally, I guarantee you, like you probably know like five other people that know me that I know, like, and it's the same way around. And it's so small and word gets around. So I think that's one of the reasons why it's really important to not burn your bridges, even if you're at a job where you hate and everything. Don't leave on a bad note. Just do what you can. And if you decide, that job ain't for you, find your next move and keep it moving. But don't burn the relationship, because people 100% talk in public health. Because I 100%, when I'm hiring for a position, I will call up a colleague if I see, oh, they worked at CDC Foundation. Oh, I have colleagues that work there. Let me call them and see what they have to say. And I've had a couple people give people bad reviews, like when I just call them and they're like, no, I don't hire them. And I'm just like, okay, say less. So definitely don't burn your bridges at all in public health.
Very, very important. I think something that's underlying the story that isn't being said is just like you are probably showing up doing good work all the time for this for the CEO of the organization to come to you and want to have that conversation and then offer you like this role that you had like no idea you could even like fit into, which I think is important.
Mm-hmm.
And is the first thing that people should be doing. It's like, how can I do my job well so that people
Mm-hmm.
know that I can do whatever job it is as well. And then you'll see different opportunities come to you, which I think
Mm-hmm.
is so, so important. And then yes, I also realized my first job after my MPH program, I was managing some contracts and I saw the prices that contractors do put for the hourly rates around evaluation type stuff and things that sometimes are very simple. Um,
Mm-hmm.
and I guess like talking to this, like this, I know you are blowing up on Instagram, on LinkedIn right now around consulting and supporting public health professionals and like understanding consulting and how they can do this more. And
Mm-hmm.
I would tell them to like go check out your platform. There's a lot of information on there that you should definitely look at. But since we're
Yeah.
here, what kind of like high level things do you think people should take and consider when they are thinking about like expanding or doing consulting?
Yeah. So I think that one of the things is to think about what type of experience do they have. So I would not recommend going into consulting if you're just starting out in the field, because you're probably not going to get much, because they do want someone that is experienced and you have the track record to show that, hey, you've done this, you have like, things that can showcase your experience, people that can vouch for you that you did this work. So I think that's number one key. Like you've got to have the experience and the expertise in the area. And once you get that, I think that being able to find opportunities, because I feel like opportunities can come in multiple ways. Because number one, you can go out and apply to RFPs, request for proposals. You can go out and apply directly to them. And then two, a lot of times, sometimes, it comes from people who don't really know that they need to contract with someone sometimes. Like, are they're just kind of like, hey, we got this small project, can you do it? Or, something like that. So a lot of times it comes from relationships and word of mouth. So that's another reason why it's important to keep those relationships, and just kind of keep maintaining those relationships with people. Because I've definitely, even this year, have gotten a contract from someone who I've worked with in the past, and they reached out to me and said, hey, you have time, can you provide some support for this project? And I'm like, yeah, I can do that. So, even that, and then some of them that I've gotten have came from, actually applying and submitting a request for proposal. And I think that, there's different ways you can do them. And then also you can think about, like, do you want to apply for federal contracts? I don't personally apply as prime for federal contracts because I know that agencies like the Guidehouse, Deloitte, like they're getting those $1 million contracts. I'm not gonna waste my time. But, there are also agencies like that who are subcontracting out because once they get these millions of dollars, they sometimes don't have a lot of people who are going to work them. That's where I come in. So I'm just like, hey, I can help you out, just give me a little cut of the money. So, just kind of thinking about, there's so many different ways to get into it. But I think that one of the things is really making sure you have that expertise and then kind of setting yourself up to show that you're an expert in this area. So whether that's you having a portfolio of your work that you can share on the ready, you having a capability statement to really show like here's my capabilities of my organization, or just kind of different things like that. Or even having a website. I don't have a website for my consulting business, and I chose not to. I didn't have the time at the time, and you don't need one, but it does show that you're credible if you do choose to have one. It's something that can really showcase your credibility, and it's a place to house your previous work or just kind of anything like that. So I think that the first step is really trying to position yourself and then also determining your area, like your niche area, because I think that a lot of times, if you do something in public health, either you're an evaluator, we do data analytics, or you can do like program development, whatever it may be. Have your specialty areas that you're really good at, and you have like things that you can showcase to say, like, yeah, here's what I did, and here's that those documents that proof that I did it. And then those are your core areas that you're going to work within. So I think that those are some really like some first things to think about when you're trying to get into it.
Well, I appreciate you sharing that foundational information, and definitely check out Desiree's platform. I would link it below. Desiree Courtney J on
Jay, yeah.
Instagram. Definitely a lot of great information there. And like I guess along that thread of you not only having this company and doing the consulting work, but now you're in a place where you're sharing that information and wanting to help other public health professionals in that realm
Mm-hmm.
of work. I wanted to ask more specifically around the social media side of things because you're killing it on social media. Like I've been slacking a lot, but seeing your posts has inspired me to like go a little bit harder. So tell us like how do you learn that social media part of things and how do you incorporate that into
Oh,
what you do?
yeah. So, I actually seen a post on LinkedIn probably about a week or so ago. And it was just this random guy, I don't even know how he popped up on my feed, but he was talking about public health and he was just talking about how we do a poor job with communications. And I was like, I cannot agree more. Like, there's so much that we could be doing in public health when it comes to communications, like with social media influencers and things like that. But we're just not doing it a lot, right? And I think that, that was one of the reasons. So back in, I think October, this past October, I was telling my husband, I was just like, I want to start posting more on social media. And I was like, are you okay with that? Because that means you might be in some of my videos. And because he is not a social media person at all. He even, once I started getting more followers and stuff, he went and put his page private. He was just like, nobody looking at me. So I was just like, okay, well, that's my personality. It's definitely not his personality. And that's fine. But I wanted to make sure I talked with him and he was okay with it. But I started like really posting more about just kind of my life, my journey. And then I started posting more about public health, about my career. And people liked it. People were interested in it. So I started doing it more and I was being very intentional about postings. I think in October, I was like, okay, I'm going to post 2 reels a day, every day, and we're going to see what happens. And I started doing it. I got like one video that had like over 1 million views, and then I got another one that had a couple million. And I was like, okay, rocking and rolling. Okay, this is what the people want to see. So, and then, and then I was just like, I seen that more people gravitated more so towards the public health type stuff, and I was like, okay, well, this could be a great platform to really talk about public health things, like not just only career stuff, but also things that I've experienced throughout my journey. So I think that one of my posts that got a lot of views, like millions of views, was me talking about my pregnancy journey, and just kind of like how I experienced I experienced like it was a story about how I experienced I had to go back to the ER after giving birth. So I had to go back to the ER after giving birth. It was probably a few days after giving birth, and I ended up waiting in the ER for like 6 hours to even be seen. And I was having like chest pain, and it was a lot. And then I had like a nurse who took my vitals tell me that, oh, you're just having anxiety. And in my head, I'm like, this is how Black women die. Like, I will not die here. Like, I'm not doing this. And like literally, I was crying in the ER in the waiting room. Like I had to go to the front desk and cry my eyes out for them to take me back and be seen. And for them to just say, oh, yeah, you just have anxiety. But then I actually got to see the doctor, and I ended up having fluid around my lungs. So they had to admit me, and my blood pressure was elevated. Like it was because I was checking my blood pressure at home, and I noticed it was increasing. So I was like, nah, babe, we got to go to the ER. So we went, and we had a newborn at the time, and it was just us. Like my parents weren't there, his parents weren't there. So we were like in the ER, like at the waiting room. They didn't have like a system where they could call you and tell you like, hey, you're ready. So you have to wait in the waiting room for you to be called. So me and him, like, I didn't want to bring the newborn into the waiting room, so we took turns like it being in the car, like just with her. And then I was exclusively breastfeeding at the time too. So I have to come out and breastfeed her and stuff like that. And it was just terrible to experience that and to just go through that. So I shared that story, and I want to make sure that my social media is a platform where I'm sharing more stories like that. Then also offering guidance. I know that a lot of public health people follow me, but just also offering guidance on how they can level up in their career and get more out of their public health career, but also show the real side of me and just kind of my experiences and even what led me and what keeps me wanting to do this work.
Yeah, well, thank you for using your platform to do that. Very inspiring. I'm definitely like, oh my God, I need to like up my game, and I will up my game. So like, hold me accountable to that, everyone. But
Yes, you got it.
but at the same point in time, like I'm sorry that had to be the situation that you were in, and I could only imagine that so many other people have experienced similar situations. And I'm glad that you are speaking up about it, so someone else has that courage to speak up about it, and hopefully that does save a life in doing so. Because as we know, the infant and maternal mortality rates for people of color, women of color, is out of this world. So I'm glad that you were able
Yeah.
to get through that and to see the doctor and to yes, but yeah, I will definitely be taking motivation from you, and I will be trying to share a lot more on my platform as well.
Yes.
Definitely go and check out Desiree's platform, everyone, if you have not as yet. I'd imagine that you probably have, but if you have not, check it out. And then to touch briefly on, because you currently work as a adjunct professor at South University and a health equity manager within a health plan. Do you want to briefly touch on those? Because I know that we're getting a little short on time here.
Yeah, yeah. So I started being an adjunct professor about 2 or so years ago. And I've literally seen the position. I applied for it, and they called me, and I had to do a actual presentation for them and how I would present to students and stuff. And they hired me. So I teach classes in health disparities and minority health. Right now, I'm teaching Introduction to Global Health. I've taught like program evaluation classes, administration courses as well. So they have me teaching a variety of things. I feel like, they kind of looked at my transcript and they were just like, oh, you got an A in this. Here we go. You can teach it. So, but it's been an awesome journey though, because I'm able to really connect with students and really just kind of understand and really kind of shift their mindsets towards thinking about not only school, but also thinking about their career as well. So I try to, like, when I'm in the discussion posts and stuff, I'm like talking to them about, like, how does this apply in actual public health? Like, what are some things that we can do as public health practitioners to really prevent these things from occurring? So really kind of getting them to think more practical application versus just like textbook application. So that's been really fun. I started working as a health equity manager for this health plan, and it has been really great because I'm able to. So a lot of health plans now are going for health equity accreditation from NCQA, and basically this is really great because it's really helping them to take a look at their processes and the things that they're doing so they can make sure that they're implementing a lot of equitable practices within their member populations. And so I am the person who is kind of working with them to not only try to help them implement a lot of health equity strategies, because one, they're doing a lot of the work already. But the thing about it is, like, some things could be a little more refined sometimes, and then sometimes we can add things. And then I think that, one of the things that I'm making sure to do is making sure that we're documenting the things that we do. Because in public health, we don't document all the things that we do a lot of times. Like, we're doing some amazing work out here, but we're just not telling people about it enough. And that is one of the major problems. So I think that when things like COVID happen, that's when people actually see public health and see what we're doing. And we're kind of under scrutiny a little bit. But then when stuff like that goes away and we're not in the public eye anymore, they're like, well, what do you even do in public health, But, and that's something that, like, we have to kind of keep talking about and keep trying to address. But I think that you're doing a great job through your podcast, definitely. And just kind of, definitely through like social media, we just got to really get the word out about the different things that you can do and that people are doing in public health. Yeah.
Love it. And then where can people connect with you, and where would you like to see yourself in the future?
Yeah, so people can connect with me definitely on my Instagram platform at Desiree Courtney J. And then also you can find me on LinkedIn, Desiree Strickland, DrPH, MPH. And then also you can head over to my website, publichealthclub.com, and join the membership. I do weekly mentorship sessions there. And we're having a host of different events that we're planning out. We're going to have guest speakers and definitely people coming to not only talk about career, but also talk about things that help get people in the discussion on public health. So one of the things that we're having towards the end of this month is going to be a talk on women's health and health equity. And then talking about what public health practitioners can do and allowing other people within the club to join the conversation, because we want to hear what everyone else has to say about it and what they think too. But yeah, that's where people can really connect with me at. I'm better within the club membership than actually, like, if people send me DMs, because I get a lot of DMs and I'm not able to answer them. But definitely that platform is where they can connect with me. And in the future, I feel as though, I feel like I'm a connector. I love connecting people. And I really want to see where the Public Health Club goes and where it takes me in my journey. I really want to still kind of continue to be able to really connect people with each other. Build community is one of the things that I love doing. So I really want to see where that goes for right now on my journey. I'm not 100% sure all the way. I think that, I feel like God gives me the thoughts, and he gives me everything I need. And then I just kind of take it, and I'm in a season of just doing everything that God has told me to do. And that's what led me to do the Public Health Club. And I'm so glad that I'm doing it, because I feel like so many people, like, one person said that it was a community they didn't know they needed. So I think that having something like that is just something that fulfills me right now, and it's what I want to continue doing.
Love it. And we are huge fans across here of the work that you're doing, and we'll continue to support. And as I said earlier, don't be surprised if you see me in the Public Health Club soon. So
Awesome.
So moving you on to the last 5 questions of the show, the Furious Five, the 5 questions asked all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Let's see, the advice I would give to a student trying to pursue a career in public health. I would say be open. Be open to all the different areas within public health. Don't limit yourself, and don't feel like just because you picked a particular track, you picked FE or biostats or whatever, that you're limited to that track after you graduate. You have an MPH. Like, yes, you have a specialization in a certain area, but that does not limit you. You've taken the basic courses, you've taken the things that you need to take. So you can transition and you can shift your career as many times as you want to. You are not stuck in being just a program manager. You're not stuck in being just a policy person. You are not. Those skills are so transferable. So I think that that is one key takeaway, is to make sure that you do not pigeonhole yourself into one area, because you can do so much.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Um, Build your community, talk to people, keep people, keep people around you who you can like look up to, that are doing things. And even if they're not your mentor per se, even if, you don't talk to them all the time or you've never talked to them, have people that you can really look to for guidance. If they're posting on social media, they're doing these things, look at their stuff, watch their stuff, see how they're moving. If they have a podcast like this, listen to podcasts like this, to get different, different aspects of, people and what they're doing. Because I think that one key thing for me is continuing to learn. I love to make sure that I'm continuing to learn, because it's so much I don't know out there. And I feel like every time I learn something new or I learn a different way of thinking, it unlocks something different in my capabilities and my capacity to do something. Because it's just like I've learned so much, and just, of course, through reading books and just listening to podcasts like this, and listening to other podcasts and listening to people talk. Like, I'm learning so much, and I get so many different ideas. Like, I have like a notes in my phone of all these different ideas that I get. And, I keep them just in case I ever want to look back on them. But this was actually an idea. The Public Health Club was an idea I had like a couple years ago, and I was looking back at my notes and I was like, oh, wow. So now I'm doing it. But it's, just making sure that you're learning and you're forever staying a student, and you're growing in that, and recognizing and being able to analyze the situation and say, what can I learn from this, versus, oh, I already know this or I've heard this before. But try to look at it from a different angle or a new perspective.
Number three, what's something you're working on improving in your life right now?
Oh, yes. I would say something I'm working on improving in my life right now. I would have to say probably my work-life balance. Um, so I would say that it's gotten a lot better since this year started, because I've been very much more intentional about it. But definitely, like this past year, it was a lot. Like, having the consulting, and then having a young Black professional, and then full time job, and having a kid, a husband. Like, it's a lot. So I think that I finally kind of am really learning that work life balance, but still, trying to improve on it, still trying to make sure that I'm incorporating things to develop my health, my overall health, making sure I'm working out, I'm eating right. Because I think that last year, like, as I'm working so much, like, I'm not eating healthy, I'm not working out. And then all those things, like, they slow you down, and, you're not able to even accomplish as much as you would accomplish if you just take an hour out of your day to work out. Or just kind of take, some time to go grocery shopping so you can have groceries, and stuff like that. So you don't have to go eat out all the time. So I think that things like that I've been incorporating since the beginning of this year. And now it's gotten to be more consistent behavior, because I think that in total, since this year started, I may have eaten out like 2 or 3 times since this year started. And I've noticed a big difference, like, in just like my energy levels, my mood. And it's been great.
That's huge. We need to see a reel on that one.
Yeah.
Number four, professionally, do you recommend anything?
I would say one of the things, if you don't want to like go back to school for something, look into certifications. I had posted a reel, and it was like, do you think you need the CHES or the MCHES? And I got a lot of like people like initially, and it's crazy, because I think initially I was just like, if you have a master's degree, no, like, I don't think you need it if you have a master's degree. However, now I actually just learned from actually one of the people that's within the Public Health Club. We were talking about it, and she was saying how now they just released new guidelines where people would, like, I think with the MCHES, they can bill to provide diabetes prevention services. They can bill health insurance plans. And I said, what? Like, we can bill now? Like, what is going on? So, thinking about that and all the new things that are coming up with certifications, and just building up your skills, I think that professionally, it's a great move. Like, especially, if you want to get into entrepreneurship or you want to partner with like a health system or hospital or just whatever, having a certification like that where you can actually bill health insurance, it's a game changer to definitely have.
And number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
So one piece of advice I would give to my younger self, well, one, invest in Bitcoin. That would be my advice. but no, seriously, I would say the one piece of advice would be to just keep going. And I think that, I look back on the times where, I thought I was going to be a pediatrician, thought I was going to go to med school. And through those times, like when I was in college, I remember like having like a breakdown because I did not know what I wanted to do next with my career. I wasn't sure I wanted to be a doctor, and I felt so much pressure on myself. But I would just tell myself to just stay consistent, just keep going, and it'll all work out. Like, just it's okay to figure things out. It's okay to not have all the answers because even now, like, I don't have all the answers. I'm still figuring things out because even, when you're building something like a community, it's a learning curve and you're learning things and it's just starting off. So it's not perfect. So it's going to grow and it's going to, go through some things and you're going to learn some things. So allowing yourself to be open to learning is something I would definitely tell my younger self to, and to just enjoy the journey because the journey is probably the most important part. Just enjoy it.
Absolutely, absolutely. Well, thank you so much, Dr. Desiree Strickland, for sharing your insights, for coming on and telling your story. I was very excited before this, and you did not disappoint in your story. And I look forward to staying connected and following along all the great things that you're doing.
Okay, thank you so much for having me.
It truly, truly is my pleasure. Housekeeping items, everyone. Thank you all so much for listening or watching to this. If you made it this far, be sure to hit that subscribe button, leave a 5-star review, and share this with a friend who gets some value from it. See you all next week. Peace.